Drawing upon 3 decades of clinical experience, I've observed a prevalent, single source of low back discomfort among patients aged 50 and older. This issue typically manifests as pain localized deep in the lower back or spanning across the lower back like a band. Today, I will provide a comprehensive guide to help you identify this specific condition, understand its root cause, and learn 4 rapid, targeted exercises designed to offer a lasting solution. The vulnerable joint, L5S1. The lumbosacral joint, L5S1, situated at the base of your spine, is the lowest and most frequently irritated spinal segment, particularly susceptible to stiffness and wear and tear as we age. Warning: 5 indicators of a stiff lumbosacral joint. You can determine if you have a restricted and painful lumbosacral joint by checking for these 5 common symptoms. Pain or difficulty regaining an upright posture after a period of sitting. Discomfort when bending forward or lifting objects. Stiffness or pain while seated and attempting to put on socks and shoes. A feeling of a sore, stiff back immediately upon waking in the morning. In some cases, pain when rolling over while lying in bed. Prohibited understanding the cause, the sitting slump. The primary mechanism that jams the lumbosacral joint out of its optimal alignment is the backward sagging of the spine that occurs when we sit, especially on soft surfaces like couches or in bed. Crucial advice: if you are experiencing low back pain, never sit in bed or prop your feet up while sitting, as these positions significantly increase the backward slump. The better way: always sit fully back in your chair and actively maintain the natural inward curve of your lower back using appropriate support. Flexed biceps: 4 quick fix exercises for lasting relief. Since sitting slumped backward forces the lumbosacral joint out of alignment, the fix is to stretch it in the opposite direction. Keycap 1 Exercise 1, the counter stretch, extension. This movement helps guide the joint back toward its normal alignment and can sometimes provide noticeable relief in as little as 30 seconds. Action: lie face down on a firm surface. Initial test: gently press up onto your elbows. If this causes sharp pain, your back may be inflamed, skip this exercise and proceed to the next one. If safe, relax into the supported position. Keep your head up without straining your neck to look straight ahead. Duration: hold for 30 seconds each night to counteract the day's sitting effects. Gradually work up to 1 minute. Progression: if comfortable, you can gently bend one knee at a time and rotate the foot slightly across the opposite leg to add a minor mobilization. Keycap 2 Exercise 2, Joint Mobilization, Rotation. The goal here is to gently open and loosen the joint using rotation, mimicking the manual release techniques used by chiropractors, osteopaths, and physical therapists. Part A. Initial rotation: lie on your back on a bed, bend your knees, and lift your thighs until they are vertical. Slowly move your knees from side to side, going only as far as is comfortable, from touching the ground to only halfway. Perform this for about 30 seconds. This also engages your core muscles. Part B. Passive stretch: finish by letting one leg hang freely over the side of the bed. Keep your chest facing upward and the other leg comfortably bent. Duration: if this provides a comfortable stretch, allow gravity to hold the stretch for about 20 seconds on each side, daily. Progression: you can gently move the hanging leg up and down slightly to further mobilize the back. Keycap 3 Exercise 3, Deep Muscle Strengthening, Multifidus. Current research highlights that weakness in the multifidus muscle, the deepest muscle in the low back, significantly increases the likelihood of recurrent back pain. This exercise targets it. Action: get onto your hands and knees, looking straight down. Tighten your abdominal muscles slightly to flatten your low back curve. The hold: while keeping your body stable, lift one arm straight out, thumb up, and lift the opposite knee 1 inch off the ground. Ensure you don't shift your weight sideways. Duration/reps: hold the position steady for 5 seconds, then switch sides. Repeat until you feel light fatigue, performing this 3 times a week. Progression: work toward the more advanced version, simultaneously lifting the opposite arm and leg straight out. Don't lift the knee higher than the hip. Maintain a straight, untwisted back. Keycap 4 Exercise 4, Pelvic Stability, Gluteal Strengthening. Weakness in the muscles responsible for keeping the pelvis level can force the lumbosacral joint into a tilted, inflamed position. This final exercise addresses that. Action: stand on one leg facing a wall. Use your fingertips on the wall gently for balance, but try not to lean heavily. Movement: begin making large, very slow circles with your non-supporting leg. Goal: continue until you feel light fatigue starting in the outer stabilizing muscles of the standing hip. Then switch sides. Progression: if 30 seconds is easy, incorporate a pelvic tilt as you circle to lift your foot higher. Keep the circle slow, especially at the highest point. Frequency: repeat on each side until light fatigue, 3 times a week. Next track button. Next steps. The lumbosacral joint and the surrounding pelvic joints are highly interdependent and often become stiff simultaneously. Would you like me to find the video on how to release your pelvic joints to complement this routine?